I'm Alvord Van Paten Valencia of DSED 3 Sciences of Negros Oriental State University, and welcome to an amazing learning opportunity with me. As future teachers, it is vital that we can recognize if a student has emotional or behavioral disorders. This allows us to provide necessary intervention to address this matter. Considering that we are geared towards student learning, students with emotional or behavioral disorders must be provided with sufficient care so that they can still learn efficiently. With that being said, today's brain food will revolve around the characteristic of students having emotional or behavioral disorders. Students suspected with emotional or behavioral disorders manifest one or more characteristics that clearly affect learning. These characteristics must be critically observed by the teacher. Still, it is best to coordinate with a specialist. Characteristic number 1. Poor academic performance not due to other disabilities. This indicates that although the student is physically normal, there is still poor academic performance. The plunging rate in class performance suggests that the student has emotional struggles that hinder in the attainment of learning. Characteristic number 2. Poor interpersonal relationship. In most cases, when there are extreme emotional struggles, a student tends to lose interest towards interaction with other people. Other than losing interest in interacting with others, some may display a foul attitude towards classmates. Characteristic number 3. Inappropriate behaviors or feelings. This could be an abrupt change in behavior or morbid thoughts and emotions. The responses towards situations may vary and is an indicator that must be detected. Characteristic number 4. Extreme unhappiness, melancholy, or depression. The emotional problems that a student has can greatly affect his or her overall well-being. The severity of these emotional struggles can result to loss of hope and intense sadness. Characteristic number 5. Unfounded physical symptoms or fears. Emotional disorders can lead to extreme anxiety. Students that have this might think that there are others who are going to harm them. There is this impractical fear that lurks in their consciousness. They can become overly protective on themselves and manifest lack of trust to anyone. For instance, Maria is known to be a top achiever in class. She graduated with highest honors in elementary. However, in the middle of the term, in grade 7, her performance drastically dropped. Interventions were given but still to no avail, and it went on for a whole quarter. Still, she loses focus and motivation, and this could be due to problems at home or any problem that she might be experiencing that really affected her performance. Maria's situation suggests that she might have an emotional disorder and emotional struggles have affected her performance. Another example, Luz, a grade 8 student, acts joyfully. However, her mood suddenly changes and becomes really gloomy. In some days, she unexpectedly grabbed her classmate's hair. This became a routine and went on for days. This suggests that Luz might have an emotional or behavioral disorder that needs keen attention. In summary, we learned that the characteristics of students having emotional or behavioral disorders are poor academic performance not due to other disabilities, poor interpersonal relationships, inappropriate behaviors or feelings, extreme unhappiness, melancholy or depression, and unfounded